LIMIS stands for Innovation in Healthcare. We have one single mission: to provide meaningful, innovative contributions for improving healthcare. LIMIS have two core activities: developing innovations for the operating room, e-coaching and training surgeons, OR assistants and other care professionals for domestic and international customers. Our full name is LIMIS Institute for Healthcare Innovations and Training. In 1998, the surgery partnership at the Leeuwarden Medical Centre, MCL, began performing laparoscopic surgery, also known as keyhole surgery.
Yes, that was a very exciting time. A time of innovation and entrepreneurship. Minimally invasive bowel surgery was still in its infancy. We were able to develop this specialism in the Netherlands, thanks in large part to our unwavering faith in this procedure and the confidence that the hospital management had in our surgical group.
Later, a major merger of care providers created a large new surgical complex with 4 hyper-modern operating rooms for minimally invasive surgery.
For years, we have been conducting side-by-side laparoscopic training courses in theatres like these. For example, for procedures such as removal of intestinal tumours. Leeuwarden's pioneering role in laparoscopic procedure has led fellow surgeons from other hospitals to come to us to learn and train. Our LIMIS training courses are now well reputed throughout the Dutch surgical community as a high-quality, certified expertise and training centre.
International conferences were organised in Leeuwarden, and LIMIS began offering its unique side-by-side training courses. Since 2003, LIMIS has trained specialists from most of the hospitals in the Netherlands. In 2007, laparoscopy at the MCL was recognised as a medical innovation by the national and local governments. As a result of a meeting of experts with important players from the business community and the government, LIMIS developed a new business development strategy.
Back then, I was quartermaster with the assignment to come up with a sustainable strategy and business plan, and finding financing for innovation and development. This has been successful. Since then, we have become an innovative institute that develops ideas and care concepts in a professional manner. But our roots, LIMIS training courses, remains an important activity.
Training is another area in which innovation can improve effectiveness. Our ambition is to earn national and international recognition as a premier training institute. 2 excellent examples include our collaboration with the Maxima Medical Center in Veldhoven and the Laurentius Hospital in Roermond, where German, Belgian and Dutch surgeons can come to attend LIMIS training courses.
Several of the employees at LIMIS have an international business or innovation management background. Professionalism, pioneering spirit and entrepreneurship are high priorities at LIMIS. A selection of our innovations.
Obesity is a serious problem for society, involving large numbers of people. It will require an equally large-scale solution, and our innovative e-coaching program helps people attain their healthy weight. It's not a diet program, but a scientifically based and effective method for changing behavior.
Another innovation is the LabWe, a training tool for surgeons that has been developed in collaboration with University Medical Center Groningen and Grendel Games. With LabWe, surgeons can learn how to perform the laparoscopic procedures while playing a video game. The video game and specially developed hardware does not simulate a surgical operation. Instead, it is an exciting virtual adventure in which the player must master obstacles to reach a certain level. In the process, the surgeon learns to develop his or her fine motor skills and hand-to-eye coordination in order to be able to perform the most complex invasive procedures successfully.
I am proud of the fact that we have LIMIS as an engine for innovation within the walls of our medical center Leeuwarden. They not only lead the way in medical innovations, but their business background also assures a professional approach and marketing skill that will benefit all the stakeholders.
LIMIS is also working on a variety of innovations related to the operating room. These include more effective applications of 3D endoscopy, training for complex procedures using professional video clips. Our research on preventing anastomoscopic leakage after intestinal operations is also part of this category, as does the research into the optimal method for tracking whether all of the equipment used has been removed from the abdomen after an operation.
I think it's great that we can apply our practical knowledge as surgeons in meaningful innovations such as the virtual operating room. New sophisticated equipment is making the modern operating theatre an increasingly complex place to work. The virtual operating room teaches OR assistants how to deal with that complexity. It is an effective and quantifiable learning method that improves patient safety.
LIMIS embraces the open innovation philosophy, in which partners, businesses and other organisations work together. Our specific knowledge partners include the Medical Centre Leeuwarden, University Medical Centre Groningen, NHL University and Twente University, but we are happy to welcome new partners. Different knowledge backgrounds and specialisms, all working towards a common goal. When we look to the future, we see ourselves as an innovation institute that is respected in the Netherlands and abroad, where the creators of new innovative ideas come to advance their further professional development at LIMIS. We see a modern employer who provides opportunities for knowledge development and job creation. A global player with an international reputation that provides an economic stimulus to the regional knowledge economy.
The healthcare sector requires several improvements and innovations. And for LIMIS, this means nice opportunities and growth perspective. Together with our current and new partners, we invest in innovative business development. So, we have a lot of confidence in the future.
LIMIS, Institute for Healthcare Innovations and Training.